The cranial nerves. This is a portion of chapter 14. This table here gives you a nice summary of your cranial nerves. It lists each nerve with its name and its corresponding number for 1 through 12. Also tells you the components. So for each nerve, you will want to make sure that you know the name and number so that you can refer to it either way or recognize the nerve when it's being discussed either by its number or its name. And of course, with our nervous system, we talk about whether things are sensory or motor in function. And then if they are motor in function, we also like to talk about if they are somatic or if they are autonomic. And then with sensory, you'll see that we begin to talk a little bit or introduce to you the special senses. And then we'll have a chapter devoted strictly to these special senses as well. So for each nerve, we said that you will want to make sure this need to know info. Name and number, sensory and or motor, and then if motor, is it autonomic? And then, of course, it wouldn't be physiology if we didn't discuss function. So you'll want to make sure that you know the name and number of each nerve, whether it is sensory and or motor, and then the actual function of the nerve. So this table gives you a nice breakdown. This is something that is definitely going to be rote memorization, so flashcards are your thing, quizzing yourself, something of that nature. So now we'll go through and we'll also show where they're located, and if you're visual, then you'll be able to put together a little bit more info. All right. All right, so the first cranial nerve 1, is your olfactory nerve. Olfactory is always going to be a sense of smell. So olfactory nerve is entirely sensory here, one of those special senses, and it will conduct the impulses for olfaction. When we spoke about each area and region of the brain, we also talked about the nerves originating or their nuclei that originated for each cranial nerve and where those were for most of our nerves. So also make sure that you begin to put those things together here as well. The optic nerve is also entirely sensory. It will conduct impulses for our vision. So optic nerve, optical. And so you can see here that the optic nerve enters into the posterior side of your eye. We'll also talk more about this when we talk about our special senses. Now, our third cranial nerve, or cranial nerve 3, is your oculomotor nerve. So the oculomotor nerve, and we also have shown here the trochlear nerve, which is cranial nerve 4, and your abducens, which is cranial nerve 6. So 3, 4, and 6 all actually are going to control the muscles that move your eyeballs. So with that being said, because they are controlling muscles that move the eyeballs, they are all motor nerves. If you have problems with these nerves and this here, the oculomotor nerve, you can end up with a strabismus, a ptosis, or a diplopia. And so that strabismus is the technical term for what we would just call cross-eyed. And then that was your oculomotor nerve. Also got us through the trochlear or cranial nerve 4. So remember motor here. And then the trigeminal nerve. The trigeminal nerve, or cranial nerve 5, is going to be a mixed sensory and motor nerve. It has several branches here. The ophthalmic branch, the maxillary branch, and the mandibular branch. So as you can see, each of these branches will help to supply those areas that the name implies. Next will be our abducens, which we talked about with the 3 nerves that are controlling the motor muscular movement of your eye. The facial nerve is going to be also mixed sensory and motor. And you see here that this facial nerve will supply, of course, the main regions of your face. Bell's palsy may be something that you've heard of before, and Bell's palsy affects the facial nerve. So oftentimes in Bell's palsy, it is a nervous condition or a nervous disorder. A lot of times people will have a facial twitch or a slight even facial paralysis because that nerve is affected. And with that facial paralysis, they'll get a little bit of drooping of one side of the face that is being affected. Now, the vestibular cochlear nerve here, this is cranial nerve 8. It is sensory. It will carry our impulses for our equilibrium and our hearing. So it goes towards the vestibule, or towards the cochlea here, which is a spiral organ we'll talk more about for your balance in your hand. Then we have, before we move on, still the vestibulocochlear nerve, or cranial nerve 8. When we talk, I guess, more about the actual this special sense here, we'll talk about vertigo, ataxia, nystagmus, and tinnitus. So tinnitus, the ringing of your ears. Vertigo will occur when people have problems with their equilibrium and their balance, and so maybe they're not able to lay completely flat. They need to keep their head elevated some, and so that's going to be because of this vestibulocochlear nerve, or cranial nerve 8. And then we have our glossopharyngeal nerve. It's cranial nerve 9. It is mixed sensory and motor. And so you'll see glosso, so it goes to part of your tongue. And then it also is going to innervate your pharynx, or your throat. So this glossopharyngeal nerve, you can have some dysphagia. That's where you're not able to chew or swallow. Also can cause some other concerns as well. Then our vagus nerve is a mixed sensory and motor nerve. The vagus nerve will stick with you for the remainder of your anatomy and physiology courses, AMP2 as well, and will be in most of your things that we talk about, because we said it is a mixed sensory and motor nerve, but you'll see here that it will innervate your heart, your larynx, your lungs, liver and gallbladder, stomach, and the rest of your gastrointestinal tract. So the vagus nerve will be very important. If you have issues with the vagus nerve, it helps to generally slow your heart rate. So if it's not functioning like it should, your heart rate would increase and you would be tachycardic. Now there's accessory nerve, or cranial nerve 11. This one is going to be strictly motor. And you'll see here that we are supplying the upper area, our trapezius of our shoulders, and then into our neck, those muscles, the sternocleidoid mastoid muscle. And then the next cranial nerve is our last one, cranial nerve number 12. It is strictly motor as well, and it is going to supply innervation below the tongue or the lingual area, and so it will help us to actually move that movement of the tongue. All right. So we said you had that table there for the summary of the nerves, and also shows you some clinical applications related to their dysfunction, as we talked about. But make sure that you know the names, those names and the numbers, and then also sensory or motor or both, and then where is it going to supply or what is its function going to be, and if that cranial nerve originates from one of the areas we talked about in the previous video when we were talking about the areas of the brain, then make sure that you also know that.